This video is about ADHD, what it is, what it isn't, and how we came to know that Jude has it.
We'd like to share some tea ideas with you today on each episode. We are going to shoot to be enjoying a different variety. We drink lots of tea at our house. Today we're drinking a kind called oolong, and it has a pretty nutty flavor. And just a couple of facts about oolong. It aids your digestion, and it also is great for your hair because it has lots of antioxidants.
Very good. Excellent. Okay, so ADHD. Let's talk about what ADHD actually is. And first of all, I'll just say ADHD is a behavioral disorder. And what that means is it is an actual disorder of the brain. It's something in the brain that's not working correctly. And so that affects the person's behavior in what it is.
Definitely, whenever you see someone that is acting out of the societal norms, sometimes we jump to conclusions. Maybe that person has not been trained well or not been disciplined well. But a lot of times there are some actual biological or chemical factors that are inhibiting behavior that we like to see in adults and in children.
Absolutely. In ADHD, there's it's sometimes used also with the term ADD, which is attention deficit disorder. ADHD stands for attention deficit hyperactivity disorder. And so technically, if you get down to it, ADD is the old term. That's the term they used before, I think, about 1994, and then they changed and said we're going to call it ADHD from this point on. Well, within ADHD, there's sort of three subtypes of ADHD. There's the inattentive, which is, if you're going to call ADD anything, that's what that would be.
And some people do still, those that are not labeled with the hyperactivity, there are still some diagnoses that will come out and say this is ADD because the person is not exhibiting, on the whole, majority of the time, a lot of hyperactivity. So, but those diagnoses are probably becoming somewhat fewer because we're seeing so much more hyperactivity in children, and we just have to be. We have to use a good evaluation to understand what we're really, really dealing with.
Absolutely. So the inattentive part is where the brain cannot focus on something. It tries. The brain certainly tries to focus. However, any other sort of distraction, things that a normal brain would just be like, okay, that's there, but I'm not going to focus on that. The ADHD brain pretty well has to focus on it. It grabs onto that, and it will start thinking about that, and it will go down all of those paths while the child or the adult is trying to think about something else. So that's what the inattentive part of it is. Then, as Heather mentioned, there's the hyperactivity or hyperactive part. And along with that goes the impulsivity. And what that is beyond the inattentive part, the person just is always has to be moving. And as the name implies, they are hyperactive.
Right.
And they are impulsive. They do things without necessarily meaning to do them. And they just, you ask them later, well, why did you do that? And they say, I don't know. I just had this feeling I had to do that. That's what I needed to do. So that's the impulsive
Right.
side of it.
It can be also described as the feeling that your body just needs to move. There's energy in certain parts of your body that basically you just need to expel. I've seen people describe it as they literally feel like their legs are going to run away from them, you know. And as we can all imagine, especially as a child in an environment that's trying to learn or gain new information, that's a very frustrating scenario to where you need to be mostly calm and still to listen, and the body is totally fighting the effort that the person is going to by the movement that it needs to have.
Right, sure. So, and then the final is the combined, to where both of these, the inattentive and the hyperactive sides, are exhibited in the same brain. And that is what we are dealing with Jude. He definitely has both of those issues. So ADHD can come from mainly two different places.
Lots of sources, but
Lots of sources.
The two main sources that we've researched mostly, definitely, you know, a lot of the population are going to fall into one of these two categories.
Right. So the first one being genetic, that it's coming through your genes, and the second being environmental, meaning that there are things in your environment,
External
factors that have basically rewired your brain to be to have this ADHD issue. So the genetic one is largely out of anyone's control.
Right.
It just, you have the genes, and
It's your genetic code.
right. And just like a lot of genes, even if you do have the genes, it may not exhibit itself.
That's right. Yeah, it doesn't necessarily mean that it's going to be manifested.
Right.
And a lot of that can actually, the genetic code can be there, and then maybe an external factor activates that.
Right.
And
Exactly.
then you start seeing the the very uncommon symptoms of what the normal development should be.
Right. And then the other environmental is a lot of times, especially more recently, the environmental aspect of this is very much related to movies, time spent in front of the TV, screen time, video games, just having a lot of that time, especially very early on,
Right.
can rewire the brain to be more hyperactive.
Yeah, and the things that your child is eating, or that you're eating, whoever is dealing with this, a lot of times it can come down to fillers and additives and food dyes, and a lot of times we're seeing people that say they're dealing with these symptoms also have food allergies or sensitivities, and there are just lots of things that can affect the brain in various ways, and it's hard to pinpoint how does this start.
Right. And again, what we're dealing with in our son Jude is the genetic side of this. Not to say that there hasn't been any sort of environmental
Right.
aspect to it, but based on the doctor's analysis and the stuff that we've researched, it definitely looks like it's strongly genetic, possibly from both sides of the family. So we've sort of talked about what ADHD is, but let's talk about what ADHD is not. And the first thing I'd like to say is it is not a blanket term just to apply to any child that has a behavior issue, a difficult child.
Right.
They have ADHD.
Yeah.
That is not the case. A difficult child is different than a child that has an actual brain issue.
A
That-
neurobiological disorder.
That's right, that they cannot control what's going on.
And it's also something to be considered that there are a lot of other conditions that, if not monitored closely, can manifest themselves as ADHD. And there are several conditions that are misdiagnosed as ADHD. And so you really have to start observing yourself or your child under a microscope to make sure that other factors may not be playing into similar symptoms.
Sure.
And that's something that as we were waiting on our evaluation, we started kind of combing through other possibilities of what could this be. And we encourage you, if you suspect that, to be diligent and do your homework.
Sure. Other behavioral disorders like autism will exhibit some similar, but also some different symptoms. And so look those up and just make sure, especially on the lower side of the autistic scale, it can look like ADHD in many cases. But again, it's not just I have a difficult child, so they have ADHD.
Yeah.
Now, we'll get into this a little bit more in a minute, but there are some things to look for specifically for the ADHD.
Right.
That go beyond just the high-spiritedness or difficultness of a child. The second thing that ADHD is not is it's not a failure of the parents in their discipline. This is something that we struggled with quite a bit at in the
questioning phase.
In the questioning phase of what this is. But again, this is an actual issue in the brain. And so there are things that an ADHD sufferer cannot control.
Right.
And so those things that they cannot control are not an issue of discipline, too much discipline, too little discipline. Consistency. It's an issue of the brain. And finally, what ADHD is not is an obvious disability.
Right.
If you were to meet our son just in Walmart, you would not look at him and say, he has ADHD.
Or a disability even.
Or a disability at all. That's right. There may be cases where it seems obvious that a child has ADHD, but on the whole, it is not something you can just look at and say, that is definitely ADHD. Mm-hmm. And with that goes the fact that it comes and goes in how intense it is.
It's very much a pendulum.
That's right.
Very much a pendulum.
And so you may be seeing Jude on a really good day and be like, I don't see what the issue is. Mm-hmm. But if you are with Jude day after day after day, you do see these cases where he's like, I don't know why I'm doing this.
The swings are, they're very largely unpredictable, but severe. You would have to spend a lot of time with the person in many cases to pick up on the deficits that are truly there.